Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about that sensation of feeling a tight band around your knee after knee replacement surgery. Why do you feel that sensation, and what are some things we can do to help manage it and alleviate that feeling? Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So there's a couple main reasons why you feel this sensation of tightness or a tight band or this pulling across your knee after surgery. So one reason is that during your knee replacement surgery, the surgeon is going to try their best to restore normal spacing and alignment to your knee joint. And what I mean by this is when you have arthritis in your knee, it's very common and very typical that you're going to have a breakdown of cartilage, you're going to have decreased fluid in the knee, you might have some issues with alignment, so you may have some knock knee where your knee comes in toward the middle of your body, you may have some bow-leggedness where your knee comes out toward the side, so they're going to restore that alignment as well. And those things are going to cause an increase in volume of the knee joint. So you think of a knee joint with arthritis, has decreased space, maybe that bone on bone going on, and then as we restore that spacing, we restore that alignment, you're actually going to increase the volume of the joint itself. So that's one reason there's going to be some increased tightness and some increased stretching on the soft tissue, the skin, the muscles, the ligaments, everything surrounding the knee joint. It's that increase in volume. Another reason for an increase in volume is going to be swelling. So obviously swelling and inflammation is a normal part of the healing process after surgery, and the swelling can be pretty significant. So you have the restoration of the new spacing and volume of the joint, then you have that swelling which is going to increase the volume of your knee joint and stretch those soft tissues even more. Another thing to think about is you have your incision down kind of the front middle part of your knee. And after the surgery is complete, the surgeon is going to take that soft tissue, pull it back together, and close it off with a suture. And again, that's another stretching, another tightening of that soft tissue, and another feeling of tension and feeling of tightness as that tissue is pulled together and then sutured back together. That is another reason you'll feel that stiffness or that tightness. Another reason is as your knee and the structures and everything around your knee heals and recovers, there's going to be that development of scar tissue. Scar tissue is kind of that, a negative word, but it's a normal part of any type of healing and recovery. And you can develop with that, as the tissues heal and are replaced with scar tissue, it's going to feel tight, it's going to feel stiff, you can develop some adhesions. And in general, this is a normal part of the process. Sometimes this scar tissue forms too quickly and we aren't able to restore range of motion, and there's some different options after that. But it is a normal part of the process, but another reason why you're going to feel some of that stiffness, some of that tightness, that feeling of a tight band around your knee. And then the last thing I want to note on is just your nervous system. So there's nerves traveling in and around your knee joint, sending information from your knee, from your leg, up to your nervous system, up to your central nervous system, your spinal cord, your brain, giving you information. And after a very serious and significant surgery like a knee replacement, it's going to be on kind of a hyper-alert, hypersensitivity state. So all the nerves around your knee are going to be very sensitive, and anything that might be a threat or might cause pain or discomfort, it's going to alert the system, and that might be a sensation of discomfort, a sensation of pain, or, of course, a sensation of that tightness or that stiffness as well. It's kind of one of your body's natural ways to protect itself. So what do we do to manage all of this? Well, the main thing is just going through the healing and the recovery process. So to decrease that formation of scar tissues, formation of adhesions and stiffness, we want to, of course, focus on our range of motion exercises, our straightening, our bending exercises, and doing those consistently every day. We also just need to give the tissues and give the nerves time to adapt, time to kind of retrain themselves to the kind of what is the new normal for your knee, your leg, and your body. So that's performed through the physical therapy, through your exercises, both range of motion exercises, strengthening exercises, but it's also just generally getting up, moving, walking, doing your day-to-day activities, and eventually starting to incorporate some regular physical activity, some regular exercise. As you're moving and your body is moving and doing things, that's how your nervous system, that's how your soft tissue, your ligaments, your tendons, your muscles start to adapt and start to kind of come into their normal kind of reset of, this is what the alignment, this is what the spacing of the knee is now. We're adapting, we're used to what these sensations are around the knee, and then you start to feel less and less of that tightness and that stiffness or that tight band sensation around the knee. So a lot of it is give it time, but we can facilitate that recovery, facilitate feeling better sooner with some physical therapy, with some exercises, with some walking, things of that nature. I hope you found this video helpful and insightful. Please be sure to leave your questions and your comments below, and I'll do my best to get back to you. As always, please be sure to hit that like button to help spread this video to other viewers. Thank you for watching, and take care.